Hi, my name is Denise Akins, and I will be discussing elimination sleep and skin and foot care of the elderly. So, insomnia, incontinence, skin and foot problems can be the most complex and challenging concerns faced by the elderly because not only do they affect their health, they also compromise their quality of life. There are millions of older adults that have bowel, bladder, and foot problems, but most are reluctant to talk about this condition. Why? Because they're embarrassed. And it's also a major inconvenience that impacts their everyday life. So, as healthcare providers, we must put these conditions on the forefront to better serve our patients. So, first, I'm going to talk about bladder elimination. So, for someone to have a normal bladder, they must have an intact brain and spinal cord. They must have a competent lower urinary tract function and have the functional ability to use the toilet. But as we age, the body changes, which includes the bladder as well. So we have incomplete emptying, increased irritability, and bladder contractions. These changes may lead to frequency, nocturia, which is having to get up in the middle of the night to pee a lot, urgency, and it increases the vulnerability of infections of the bladder as well. So urinary incontinence is a common problem of the elderly. This is involuntary loss of urine that is sufficient enough to be a problem. So there are risk factors for UI. These are cognitive impairment. This is someone who has altered mental status. Limitations in daily activities. These are people who cannot perform their daily activities on their own, such as bathing, cooking, going to the bathroom. And then we have those that are institutionalized, those that are in nursing homes and rehabs who have to call for assistance and aren't able to get that in time. So there are different types of UI. This includes urge, which is pretty much an overactive bladder. When someone senses the urge to have to go, they have to go right away. And then we have stress incontinence. This is caused by activities that increase your intra-abdominal pressure, such as coughing and sneezing. When you do those things, urine may leak out. And then we have functional incontinence. This is the patient who has that lower urinary tract function, but they aren't able to get to the bathroom due to environmental barriers. Then we have bowel elimination. So normal elimination of the bowels or feces should be undue with no straining and no feeling of incomplete evacuation of feces. So constipation is the most common GI complaint, and fecal impactation is a major complication of constipation. So basically, this is the paradoxical of diarrhea, where the fecal mass is there, the patient can't push that out, but there is a leakage of diarrhea that seeps through. And then fecal incontinence. This is continuous or recurrent, uncontrolled passage of fecal material for at least 1 month. There are more than 6.5 million Americans that have fecal incontinence that are afraid to address the issue with their primary care providers. Sleep. So we all need sleep. We all need rest. This is how we conserve our energy. This is how we prevent fatigue and relieve tension. So older adults, they need just as much sleep as younger adults. But when we age, sleep becomes more fragmented. We wake up a lot during the night, and it's much lighter. So the common sleep disorders are insomnia. Insomnia is when the patient has the opportunity to sleep, but they can't. And this is usually diagnosed with 1 month of not being able to sleep consistently. We also have sleep apnea. This is when someone stops breathing during their sleep. We have restless leg syndrome, which is a neurological sensation of the legs that disrupts sleep. And then we have rapid eye movement sleep behavior disorder. So this is pretty much a complex behavior that causes the patient to have violent dreams. They may kick and punch in their sleep as well. So this disrupts sleep for a lot of elderly. And that is known as RBSD. Now we're going to discuss skin problems. So there are many skin problems that are seen with the aging. They can be compromised by health or mobility limitations. So the number one mobility limitation skin issue is the cubitus ulcers. This is caused when patients are sitting in one place for too long period of time. They develop these pressure sores. So basically, this can be even very hard to treat wound-wise when there's also some bowel and urinary incontinence as well. We have cirrhosis, which is dry, cracked skin. Pruritus, which is itchy skin. seborrheic keratosis, which is benign growth of the skin, usually seen on the trunk. Herpes zoster, which also known as shingles. It is a viral infection that causes painful blisters. And then cancer. So cancer can be caused by too much exposure to the sun, tanning beds, and even carcinogenic material to the skin. And the last thing we're going to discuss is foot care. So feet influence one's physical, psychological, and social well-being. There are many foot irregularities, and they are inherited. They can be inherited, while others are caused by wear and tear, certain disorders such as neuropathy, or altered foot integrity. So we have common foot problems are corns, calluses, and bunions. These pretty much are abnormal growths that become very painful. Usually the bone may push up against the shoes or cause changes in that nature. And then we have hammer toes. There's a picture of a hammer toe, and it's pretty much is a claw-like appearance of the toe, and this limits one's ability to walk. And then we have fungal infections. These may not be painful, but they do cause a yellow or brown discoloration of the toe, and they aren't pleasant to look at physically, and they are very hard to treat. Next, Ricky is going to talk about the nursing interventions.
Thank you, Denise, for your introduction. I am now going to go over some interventions for elimination, sleep, foot care, and skin in the elderly. And we'll start with urinary incontinence, as you can see right here that I have listed for the elderly. And basically with urinary incontinence, it's just the involuntary loss of urine. What we have found is a lot of times it's environmental barriers that make it difficult for the patient to void. So sometimes there are problems that prevent the patient from getting to the bathroom or removing their clothing or transferring to the toilet. If you can get the patient on a toileting schedule, that will, guarantee the patient a designated time for voiding and then reduce episodes of the incontinence. As you can see here, I have limit fluid intakes 2 to 3 hours before bedtime. And by restricting the fluid intake and voiding before bedtime, that reduces the need to disrupt the sleep for voiding. I do think that it is promoted when the caregiver responds promptly to the patient's request to help with voiding. So these would be some interventions for urinary incontinence. Okay, although you have urinary incontinence, you have diarrhea, they're common in the elderly. The main problem is constipation. And with constipation, I've found with the elderly, it's a lot of times due to a sedentary lifestyle. A lot of times they're sitting all day, or they have lack of exercise or prolonged bed rest that contributes to the constipation. Drugs can also be a big problem because that can slow down peristalsis. Many times it's the narcotics that contribute to the constipation. Defecation is a private thing, so you want to promote privacy with the elderly so that they're able to eliminate as a free will on their own. Even though I say to increase the fiber intake, you don't want to abuse laxatives and enemas because that can cause muscles and the nerves of the colons to function inadequately. Insomnia is another big problem with the elderly, and here you have some nursing interventions for the insomnia. A lot of times it is related to anxiety, but the amount of sleep that the elderly would need will be individual to that particular person. If you can get them on some type of ritual or routine, then that will induce comfort and relaxation for them to be able to sleep properly. You do want the patient to be able to sleep through the night consistently, so you don't want them depending on sleeping aids. If you can know the causative factor of what is the problem while they're having the insomnia, then a lot of times then you can implement the change. These are the interventions for insomnia listed here. In regards to the skin, as stated earlier by Denise, there are many skin disorders of the elderly, some cancerous, some non-cancerous, but it is important that these interventions that I have listed here are implemented so that the elderly can take care of their skin. As they get older, the skin becomes thinner and drier, and that's really easy for injury. Also, with the elderlies, if there's a skin infection or a non-healing wound, that could be serious or even fatal. So it's very important to follow these interventions. With extra care, it's definitely needed for bed sores because that's very common in nursing home among the elderly patients. Foot care, foot problems can have a negative impact on your daily living. You want to have good foot care in order to decrease pain and increase their mobility and physical activity. Therefore, that increases the self-esteem in the elderly as well. With these interventions, I'm also going to suggest a podiatrist because a lot of times their toenails become really thick and they're unable to reach their feet and clip their toenails, or they may have visual impairments or arthritis that may prevent them from doing this. I'm going to go over the teaching and learning strategies. So as again, just to reiterate, these are some teaching and learning strategies that you will implement. Some for insomnia, skin, and foot care. Of course, you want to exercise, you want to moisturize. And a continuation, make sure you wear your shoes at all times to prevent foot injury. Again, the podiatrist, and definitely will report changes. I'm now going to introduce Lana, who's going to go over some alternative care options in the elderly. Lana.
Hi, my name is Laha Alizada, and for this project about eliminations, sleep, and skin problems for elder adults, I will be talking about alternative care for these patients. Denise and Rukia has already talked about the elimination, sleep, and skin problems that elderly adults have. Now, what I'm going to be talking about, since it's alternative care, first, we need to make sure that these patients always keep a log of UI events. They need to make sure that they monitor their toileting regimens, determining frequency of need, and developing a schedule and assist to toilet. We need to consider recent medication changes as well, because some medications will cause you to have constipation, some medications will cause you to have diarrhea, and so on. To prevent the skin breakdown with these elderly adults, we need to make sure that we work towards improved continence of these patients. We need to also make sure that we promptly change the absorbent undergarments and clean their perineum and buttocks and apply Balsa cream if it's needed. Using a skin barrier. Balsa cream is one of the skin barriers that we use in our hospital, and it does wonders. Like one day it'll be red, the buttocks will be red, and then the next day we'll come back after applying the Balsa cream in a proper manner. Then the next day, it's actually, the redness is gone. Another thing that we need to make sure we do with these patients is promptly report any changes in the skin. We need to make sure that the elderly adults, they need to know when and how to recognize that they have a skin problem and then tell somebody about it. A lot of the times what happens with these elderly adults is that they'll lay down all day or sit down on a couch and watch TV, and they won't realize that they have any sores or anything till their problems that they have will progress, and then they will end up in a hospital, which will then require us to do a wound care consult so they could come in and stage their wounds in their buttocks or in their heels and so forth. As an alternative care for the elderly adults, we can make sure that they know about simple clothing changes. Some of the simple clothing changes include, like if patients use Velcro closures on shirts, pants, shoes, this all makes on and off less effortful. We can also teach them about elastic waistbands and Lumiere fit, ease up, down, or pants, and we can make sure that they know about adding rings onto the zippers. This makes the process of elimination much easier for these patients. Here's our references for